Okay, let's unpack this. Are you managing high blood pressure, maybe with medication, but you're also, curious about those remedies?
Maybe your grandmother swore by them.
Right. It's a common situation.
Well, you're definitely not alone. Millions face this exact dilemma every single day.
Yeah.
So today we're doing a deep dive. The truth about traditional medicine versus modern pharmaceuticals for high blood pressure. Especially, for those of us over 60. Our mission. We want to uncover which approach works best, expose some dangerous misconceptions, and really show you how to safely and effectively combine both worlds. For optimal results, it's about getting to the heart of what's truly effective and, crucially, what's safe.
Absolutely. And our sources highlight that both traditional and modern approaches can be dangerous when they're misunderstood.
Exactly. Just look at Sarah, a 68-year-old grandmother. She nearly ended up in the emergency room after mixing her blood pressure medication with what she thought was just a harmless herbal tea. And her story isn't unique, unfortunately. It really underscores how important it is to get this right. What's fascinating here, though, is that the goal isn't really to choose a side, is it?
No, not at all.
It's more about understanding the distinct strengths and weaknesses of each system, and, critically, how they interact within your unique body as you age.
That deeper understanding is precisely what we're aiming for today. So, diving into modern medicine first. What exactly are its greatest strengths when it comes to blood pressure control, especially for our audience?
Okay, so modern medicine, especially for blood pressure, it brings incredible precision. Think about the 2024 clinical guidelines from the American Heart Association. These are built on decades of really rigorous scientific research.
Right, solid evidence.
Solid evidence. And the drugs themselves are like precision tools. ACE inhibitors, for example, they directly target specific enzymes that constrict your blood vessels, basically telling them to relax.
Okay.
Beta blockers, on the other hand, they step in to kind of calm your heart's response to stress hormones.
So very targeted actions.
Extremely targeted. The key takeaway for you is this. These aren't vague treatments. They are chemically engineered to perform very specific, measurable actions on your body. And that often leads to rapid and significant blood pressure reduction.
Right, that makes sense. A laser-focused approach. And what are the general guidelines, the targets for blood pressure? Do those shift for someone, say, over 60?
They absolutely can, yeah. For adults under 65, the target is typically around 30-30-80. But for those over 65, the current recommendation is generally below 40-80.
A bit higher.
A bit higher. And this precision targeting, it prevented millions of heart attacks and strokes. There was the SPRINT trial, a really large study focusing on blood pressure in seniors. It showed that intensive treatment actually reduced cardiovascular events by 25% in people over 75.
25%. Wow, that's significant.
It's a significant, measurable impact. Huge.
That's incredibly powerful evidence for modern medicine, definitely. But are there aspects maybe less talked about that seniors specifically need to be aware of when considering these treatments? The pitfalls.
Yes, there are crucial considerations. Seniors, unfortunately, face a significantly higher risk of medication-related complications.
Like what, specifically?
Well, things like dizziness and fatigue. They might seem minor, right?
Yeah.
But they're actually leading causes of dangerous falls in people over 70. And this is often due to something called orthostatic hypotension.
Which is?
It's when your blood pressure drops too quickly when you stand up.
Okay. Got it.
And, Dr. Jennifer Chen, a geriatric cardiologist at Mayo Clinic, she notes that what works perfectly for a 45-year-old might be too aggressive for a 75-year-old.
Why is that?
It's partly because aging kidneys process medications differently. Things slow down. So the start low, go slow approach isn't just a suggestion, it's really crucial.
Start low, go slow. Okay.
In fact, the latest European Society of Hypertension guidelines even suggest that for patients over 80, the target might need to be slightly higher, maybe 140, 150 systolic.
Really? Why higher?
Because sometimes being overly aggressive with treatment in that age group can actually cause more harm than benefit. It's a delicate balance.
That makes sense. Beyond these individual challenges, many seniors face what's called polypharmacy. How does juggling multiple prescriptions complicate blood pressure management?
Oh, this is where it really gets complicated and, frankly, potentially dangerous. The average American over 65 takes, 4 to 6 medications daily, sometimes more.
Wow, 4 to 6?
Yeah, so when you add blood pressure drugs into that mix, maybe with others for diabetes, cholesterol, arthritis, whatever, the risk of dangerous interactions and side effects it just increases exponentially. It's not additive, it's multiplicative.
Exponentially. That's worrying.
It is. And recent studies show that medication adherence, actually taking the pills correctly, it drops significantly with more drugs. Some data suggests 50% of seniors skip doses or stop their blood pressure medication within the first year.
50%. Why?
Often due to side effects or just confusion about their complex regimen. Sounds like a delicate dance, right?
Or maybe more like juggling flaming torches, trying to manage all that.
Yeah, exactly. That's a good way to put it.
It certainly sounds challenging. So, given these risks, when does modern medicine truly shine brightest? When are these risks worth taking?
It's absolutely essential in critical scenarios, no question. We're talking about acute hypertensive crises where immediate action is needed to prevent severe damage. Or consistently high blood pressure, say above 160/100.
Okay.
And definitely for patients who also have diabetes, kidney disease, or heart failure. These conditions make blood pressure control even more critical. And it's vital for anyone who's already had a heart attack or stroke. Prevention of a second event is key.
Right.
Its key advantage really is standardization and predictability. You get consistent, measurable results that can be precisely tracked and adjusted by a doctor.
Predictability, that's valuable.
Very. However, and this is important, this raises a question. While modern medicine is vital, it shouldn't be seen as the only solution, should it? Sometimes it means we neglect those underlying lifestyle factors that contribute to high blood pressure in the first place.
That's a crucial point. Which leads us nicely to the other side of the coin. Let's explore the world of traditional remedies, but importantly, with the scientific lens that modern research provides. This isn't about, folklore. It's about understanding what actually works and what doesn't.
Precisely. Let's look at some examples where traditional remedies do have some scientific backing. Take garlic, for instance. It's not just for cooking.
Right.
Recent 2024 research actually shows that aged garlic extract can reduce systolic blood pressure by an average of 8 to 10 points. Millimeters of mercury, that is.
8 to 10 points from garlic. That's impressive.
It is. Garlic's power seems to come from its active compound, allicin. Imagine allicin gently telling your blood vessels to relax and widen. It's a process called vasodilation, which helps blood flow more easily. It's somewhat similar mechanistically to how some modern medications function, but maybe milder.
That's remarkable for garlic. Does this scientific backing hold true for a wide range of traditional remedies, or are we looking at just a select few that genuinely deliver results?
Well, we're looking at a select, but definitely growing number with pretty strong evidence. Hawthorn berry, for example. It's been used in traditional Chinese medicine for, over 2,000 years.
Wow.
It contains compounds that seem to strengthen the heart muscle and improve circulation. A 2024 systematic review found it could reduce blood pressure by about 536 points systolic, and also improve exercise tolerance in elderly patients, which is interesting.
It's interesting, yeah. What else?
And then there's celery seed extract, long used in Ayurvedic medicine. It contains these compounds called thalids that improve blood flow, and modern research is actually validating its mild diuretic effects and anti-inflammatory properties too.
So it seems these aren't just old wives' tales then. There's real science emerging behind some of them. And you mentioned a gentle approach.
That's right. The gentle approach advantage of some traditional remedies is also appealing, especially for seniors perhaps. Unlike pharmaceuticals that often target very specific pathways with, intense precision, traditional remedies often seem to work through multiple mechanisms, maybe with fewer immediate side effects. Take green tea. It might lower blood pressure partly through its catechins, but it also provides antioxidants, which protect blood vessel walls and offers anti-inflammatory benefits. It's kind of a multi-pronged approach, potentially less aggressive.
Okay, that sounds good. But here's the critical reality check we need to make. Traditional doesn't automatically mean safe. We hear this phrase often, but it's vital to understand why it's a dangerous misconception.
Absolutely vital. Just because something is natural, quote unquote, doesn't mean it's harmless or right for everyone. Ginseng, for instance, can actually raise blood pressure in some individuals.
Raise it, okay.
Yeah, particularly if they're on certain medications. And licorice root, it's found in many traditional formulas and teas. It can cause the body to retain sodium, leading to dangerous spikes in blood pressure.
Good to know.
Another major issue is the dosage dilemma. Traditional remedies often lack standardization.
What does that mean exactly?
It means the concentration of the active compounds, the stuff that actually does something, can vary widely from batch to batch or brand to brand. This makes consistent dosing nearly impossible without expert guidance. It's a bit like trying to bake without reliable measuring spoons. You don't know what you're really getting.
Right. Consistency is key with medication. And what about interactions with modern drugs? Is that a big concern or more anecdotal?
Oh, it's a huge research-backed concern. This is what we call the interaction trap.
Okay.
Recent research shows that garlic supplements, for example, can dangerously increase the effects of some blood pressure medications, causing blood pressure to drop too low, which is also dangerous. Hawthorn can enhance the effects of beta blockers and calcium channel blockers, maybe leading to an excessively slow heart rate. And ginkgo biloba, popular for memory.
Yeah, I know that one.
It can interfere with how the body metabolizes certain blood pressure medications, making them either less effective or potentially more potent than intended. And the latest clinical data shows these interactions are particularly concerning in elderly patients. Their bodies just process both herbs and drugs differently, often more slowly.
That really changes how you have to think about what you're putting into your body, doesn't it? And the quality of these supplements themselves. Can we, rely on them?
Unfortunately, no, not always. That's the quality and purity problem. Unlike prescription medications, which undergo really rigorous testing and standardization, herbal supplements exist in a largely unregulated market, especially in some places.
Unregulated, meaning?
Meaning there are real concerns about things like heavy metal contamination, pesticide residues, or even just misidentification of the plants used. A 2024 analysis of commercially available garlic supplements, for instance, it found that the actual allicin content, the active ingredient, varied by up to 300% from what was listed on the labels.
300%. That's shocking.
It's a shocking variance.
Yeah.
Imagine buying a pain reliever and not knowing if it's 10% or 100% effective. That's kind of the situation with some supplements.
Indeed. Okay, so given all these caveats, the interactions, the quality issues, the dosing problems, when does traditional medicine work best? Where does it fit?
Well, it seems to show the most promise in a few areas, as complementary support alongside conventional treatment, not instead of it.
Complementary, okay.
For prevention, perhaps, especially with borderline high blood pressure. As part of long-term lifestyle approaches that address the root causes like diet and stress, and maybe as gentle interventions for those specific individuals who really struggle to tolerate pharmaceutical side effects. But it's crucial to understand their pace. Traditional remedies typically work slowly, usually need weeks or even months of consistent use to see measurable benefits. It's not like taking a pill that works in an hour.
Weeks or months, good point. Patience is needed. Okay, now, let's really get into some of the most dangerous myths. The ones that have landed patients in emergency rooms, sadly, and nearly cost lives when trying to manage blood pressure after 60.
Yeah, this is critical information for everyone listening. Let's break these down. Myth, #1. Natural means it can't hurt me.
The big one.
This is perhaps the most pervasive and dangerous belief. You hear about Martha, a 72-year-old patient. Her blood pressure spiked dangerously after taking a natural blood pressure formula she bought online. She thought it was safer.
What was in it?
Turns out it contained licorice root extract, which, as we mentioned, can cause severe sodium retention and dangerous blood pressure spikes. The truth is, natural compounds can be just as potent and just as dangerous as synthetic drugs. Remember, digitalis.
The heart medication.
Exactly. It comes directly from the foxglove plant. Just because nature produces it doesn't make it automatically safe in any quantity or combination. Nature makes poisons too.
That's a powerful reminder. Absolutely. Okay, what's the next common misconception we need to tackle?
Myth, #2. I can stop my medication once I start herbs.
Oof. Yeah, that sounds risky.
It nearly killed James, a 69-year-old mentioned in the sources. He read somewhere online that garlic could replace his ACE inhibitor, so he stopped his prescription cold turkey.
Oh no!
And started taking high-dose garlic supplements. Within 2 weeks, his blood pressure shot up to stroke-level readings. He ended up in the hospital. Stopping blood pressure medications abruptly can cause dangerous rebound hypertension.
Rebound, meaning it goes even higher.
Exactly. Higher than it was before treatment. Any transition, if appropriate, must be gradual and always medically supervised. Always.
That's terrifying and highlights the need for doctor oversight. What about mixing treatments?
Right, that leads directly to myth, #3. Traditional medicine doesn't interact with modern drugs.
We touched on this, but it bears repeating.
It absolutely does. This dangerous assumption affects thousands of seniors every single day. Recent clinical research is very clear on this. We mentioned green tea potentially reducing the effectiveness of Nadolol, a beta blocker, by up to 85%.
85%. That basically makes the drug useless.
Pretty much. Ginkgo biloba can interfere with losartan metabolism, potentially making it less effective. And 2024 cardiovascular research shows that berberine, which is popular in traditional Chinese medicine, it significantly affects how the liver processes several common blood pressure medications. This could lead to either dangerous accumulation of the drug in your system or inadequate levels, so it doesn't work properly.
It really changes how you look at that natural supplement aisle, doesn't it?
It absolutely should.
Okay, what's another common trap people fall into?
Then there's myth, #4. More is better when it comes to natural remedies.
Right, if a little is good, a lot must be great.
Exactly the thinking. Susan, a 74-year-old grandmother in one case study, thought if one garlic capsule helped, 4 would be even better. She ended up with dangerous bleeding because the high-dose garlic interacted with her daily baby aspirin, required emergency treatment.
Wow.
The truth is, traditional remedies have therapeutic windows, just like pharmaceutical drugs. There's an optimal dose. Exceeding recommended doses doesn't usually increase benefit, but it can cause serious side effects, things like excessive bleeding, dangerous drops in blood pressure, or even liver toxicity with some herbs.
That's a really common misconception with supplements in general, I think. And then there's the fear of dependency, right? People worry about getting hooked on BP meds.
Precisely. Which brings us to myth #5. Blood pressure medication is addictive. This fear keeps many seniors from taking potentially life-saving medications. It's important to clarify this. Unlike, say, certain pain medications or anxiety drugs, blood pressure medications don't create psychological dependence or addiction.
Okay, that's key.
Your body does adapt to them physiologically, which is why stopping suddenly can be dangerous, causing that rebound effect we talked about. But this is a physical adjustment, not addiction in the way people usually think of it.
Got it. Important distinction. And finally, the timing. How quickly should people expect results from traditional remedies?
That leads nicely to myth #6. Traditional remedies work immediately.
Like flipping a switch?
Yeah, many patients expect instant results, similar to popping a pharmaceutical pill. But the reality, as we discussed, is that traditional remedies typically work slowly. They build effects over weeks or months.
All right.
And this mismatch in expectation often leads to dangerous situations. Patients might increase doses rapidly, thinking the remedy isn't working, potentially hitting toxic levels, or they abandon an effective conventional treatment too early, putting themselves at risk.
So patience and realistic expectations are crucial there.
Absolutely. And if we sort of connect all these myths to the bigger picture, perhaps the most dangerous misconception overarching all of this is thinking you can just randomly combine approaches yourself without professional guidance.
Winging it, basically.
Yeah, winging it's highly individualized. What works safely for your neighbor might be dangerous for you. Depends on your specific medications, your other health conditions, even your genetic makeup. Then there's that quality control reality we talked about.
The unregulated market.
Exactly. The supplement industry often lacks the stringent quality controls of pharmaceutical manufacturing. That 2024 analysis again found 43% of herbal supplements tested had less than half of their claimed active ingredients.
Less than half.
And 12% contained potentially harmful contaminants. You just don't always know what you're buying.
That's deeply concerning.
It is. And this also ties into the one-size-fits-all fallacy. Authentic traditional medicine systems, like traditional Chinese medicine or Ayurveda, are actually highly individualized. Practitioners consider your specific constitution, your pulse, your tongue, lots of factors, which is completely ignored when you just buy a standardized supplement off the shelf based on a general article you read.
Right, it loses that personalization.
Completely. And finally, there's the timing misconception. Many people just take their herbs and medications together, maybe with breakfast, but research shows timing matters significantly. Some herbs need to be taken hours apart from certain medications to avoid interference with absorption or metabolism.
Okay.
Ultimately, breaking through all these myths, it just requires education and critically professional guidance. Your body at 60, 70, or 80 processes everything differently than it did at 40. You need expert advice.
Okay. After exploring both worlds, the modern and the traditional, and exposing those really critical myths, what's the path forward? How can you, the listener, intelligently combine the best of both worlds, safely and effectively?
Right, the practical steps. Well, the foundation principle is absolutely non-negotiable. Medical supervision first.
Non-negotiable.
Especially for anyone over 60 managing blood pressure. You need to establish a healthcare team. This ideally includes your conventional doctor, but maybe also practitioners trained in traditional medicine who are willing to coordinate care. That coordination is key.
So everyone's on the same page.
Everyone's on the same page. This ensures you maximize potential benefits while minimizing those interaction risks we discussed. Then, the advice is usually to take a gradual integration approach.
Start slow.
Start slow. Begin with lifestyle modifications that are supported by both approaches. Things like stress reduction meditation, tai chi, yoga, a whole foods diet, reducing sodium, gentle, regular exercise. These create a crucial foundation for everything else.
Makes sense. And then for adding remedies.
When and if you consider adding traditional remedies, the key is one at a time. Add just one, give it a decent amount of time, maybe 4 to 6 weeks, to assess its effects and any side effects, before even thinking about adding anything else. This methodical approach helps pinpoint what actually works safely for you.
Okay, so smart supplementation, but with extreme caution and really careful planning.
Exactly. With proper guidance, and I can't stress that enough, certain traditional remedies might be safely incorporated alongside conventional blood pressure medications for some people. We're talking about things like maybe 1-2 cups of green tea daily, but not taken at the same time as medications.
Right, the timing issue.
Omega-3 fatty acids from good quality fish oil, but again with doctor approval, especially if you're on blood thinners. Magnesium supplementation might help some, but strictly under medical supervision, as too much can cause problems. Stress-reducing herbs like ashwagandha could be considered, but again, timing and potential interactions matter.
The mantra seems to be check first.
Always check first. And remember the spacing rule. Always aim to space herbal supplements at least 2 to 3 hours apart from prescription medications to minimize interaction risks.
2 to 3 hours. Okay, good practical tip. And how do we track progress and spot potential problems when making these kinds of changes?
That's where the monitoring protocol becomes absolutely essential. Regular home blood pressure monitoring is critical anyway, but it becomes even more critical when you're integrating approaches.
How often?
I'd recommend daily monitoring, maybe even twice daily, for at least the first month when making any significant changes, adding an herb, changing a dose, and keep a detailed log.
What goes in the log?
Your readings, taken at consistent times, what medications you took and when, what traditional remedies you used, the dose and when. But also importantly, how you feel, your energy levels, any dizziness, sleep quality, any unusual symptoms at all. This detailed log is absolute gold for your healthcare team. It helps them see patterns.
That makes sense.
Yeah.
Provides real data. Now, what are the absolute red flag situations? When do you need immediate medical help? When should you drop everything and call your doctor? Or even seek emergency care?
Okay, critical red flags. Immediately contact your doctor or seek urgent care if you experience sudden, significant blood pressure spikes, say consistently above 161/100 or whatever threshold your doctor set, dizziness or fainting, especially when standing up, that orthostatic hypotension again, any chest pain or shortness of breath.
Okay.
Unusual bleeding or bruising, particularly if you're on blood thinners or taking things like garlic or ginkgo, or severe headaches or sudden vision changes. These can signal dangerously high pressure and require immediate medical attention. Don't wait.
Right. Don't wait. Crucial advice. So it sounds like this whole integration process, it's a long-term strategy, isn't it? An evolving, personalized approach, definitely not a quick fix.
Exactly. That's the perfect way to put it. Integration is a personalized journey that evolves as you age and as your health changes. It truly is a marathon, not a sprint. The goal isn't overnight perfection. It's about sustainable improvement that genuinely enhances your quality of life and health span. And the key to navigating it successfully is maintaining that open, honest communication with all your healthcare providers. Because what works for you at 65 might need careful adjustment when you're 75 or 85.
That constant dialogue is key. So, wrapping this up, what does this all mean for you, the listener? Your health journey is absolutely unique. But by understanding these nuances, the strengths and pitfalls of both traditional wisdom and modern science, you really unlock unprecedented opportunities for optimal aging, for managing your blood pressure effectively and safely. If you are considering any changes at all to your blood pressure management plan, the very first step has to be an honest conversation with your doctor. Tell them about your interest in integrative approaches. Ask specifically about your medications and potential interactions with anything you're considering. And maybe consider consulting a qualified traditional medicine practitioner, a naturopath, an acupuncturist, whoever, who has experience and is willing to work collaboratively with your conventional physician.
And this really raises an important question, doesn't it? How can you truly empower yourself in what is, let's face it, a pretty complex landscape? Well, remember this, the best medicine is informed medicine. By deeply understanding both the traditional and the modern approaches to managing your blood pressure, you're taking control of your health in the most empowering way possible, and hopefully avoiding those pitfalls and dangerous myths that unfortunately trap so many others.